So I would like to warmly welcome all of you today in a PhD defense. We so-call it progress report. And I would like to start a little overview about where we are currently and where we are going actually in this program. So I would like to warmly welcome the committee, also the student supervisors, students in today's meeting. So actually this event is a Progress Report 8, actually today, which is the final progress report during the student's journey. And just a little overview why we are here. I am really very proud to be a member of Academy of Europea, which is the largest academy in Europe, having 92 Nobel laureates. And with them, it was a pleasure to build up a program, actually, which concentrates on healthcare professionals, how the healthcare professionals can be better doctors, dietitians, psychologists, or physiotherapists. And the main aim of the program, due to scientific activity, to generate a new knowledge database, communicate back to healthcare, and immediately turn it for patients' benefits. And we were really very proud that after the first 5 years of the journey, Nature Medicine found really innovative enough the program to publish it in 2021. But why is it important? Why there is an unmet need for such a program? I think if we look at the data, it's really scary. The European Union Statistical Office, the Eurostat, published the data, which mean that under 75, 1.7 million people die annually. However, if we used all the scientific knowledge we generated in the past, 1.2 million people's lives could have been saved. And in Eastern countries, where the scientific activity is not as high as like in the Western Europe, 4 of 5 deaths could have been avoided if also the patients, also the students, also the doctors would use really the knowledge. So there is an unmet need to bring science actually into healthcare. And this program is not about PhD. It's interesting to say this, but this is actually for the patients, for better healthcare. And I just would like to show you 3 very small examples which actually came to patients' benefit. So the program was started at the University of Péter, where a resident doctor came to Péter and started understanding about the antibiotic usage in pancreatitis. And when she returned back to the hospital, she could immediately, within the first year, decrease the antibiotic usage with 31% before defending the PhD. There is another example from the Heimpath Children's Hospital when they started screening CFTR crits much earlier than actually in the guideline due to the recent scientific activity. And it turned out that within 1 year, they could identify 30% of the patient with abnormal glucose tolerance much before they had visual impairment in the school. And only after that, the students defend the PhD. This is another example, Kata Illés, who is coming from the first line. They came from the Bajcsi Hospital and asked a very simple question: what kind of methodologies can help actually to decrease the recidive attack of cholesteatoma? And they not only could find out that the mastoid obliteration is the best and published it, one of the most decent otorhinopharyngology journal, but they immediately used for all patients at the hospital. And within 1 year, they could decrease with 13% the recidive attack as cholesteatoma. Kata hasn't defended her PhD yet. So this program is translating scientific knowledge for patients' benefits. And we are really very proud that this October will be really very fruitful, because in October we had also 2 publications concerning this kind of systems education, both at Times Higher Education and also in 17th of October, Nature Medicine also published about this model. However, of course, there are not only the patients heal better, but also there are a huge amount of young individuals who can grow actually in this program. So this program was started at the University of Péter, actually in 2019. So the first 2 years went there, and after at Semmelweis University, the first year was in 2021 with 91 students, and usually this is the number of students we can accommodate here. Now we have students from 24 countries. And I must say that one of the most active group is the critical care or intensive care group led by Zsolt Molnár. And now here I must say that in my entire career, I never seen somebody who looked after young individuals and grow them up, you know, during their journey. And he's really, really one of the key person at the Center of Translational Medicine, and he is leading over 20 students, supervising 20 students in this program. And this is just a little overview about the publications. We already had, within a very short period, 266 publications, where 41% actually published in D1 journal, and almost most of them in a Q1 journal. And if you look at the name of the journals where we could publish articles, I think this is really suggesting a high level of science. So this is the summary. We started the 4th year in this program, and now over 600 people are affiliated to program somehow. But as I mentioned at the very beginning, this is mostly for patient and for the society. So we are not only concentrating publishing articles in decent scientific journals, but also highly important to give this actually knowledge back for the society. So we are publishing articles also in regular journals what the society people can read. So this is the 8th progress report. It's not easy to reach there, but of course it's a possibility. 91 students started their journey, and in every 3 months, of course, there were students who couldn't continue the program, and at the end of the 2 years, actually 81% of the students could pass the complex exam, so 4 of 5, which is really, I would say, quite a good number. And of course, the students are required actually to submit their first paper by the complex exam. They have to have an accepted paper until year 3. They have to have the submitted paper at the year 4, and 2 Q1 journals are necessary to submit their thesis. So we are actually only in year 4 at the beginning, but there are already students who 1.5 years before the deadline finishing could achieve this program. And I am more than happy to let you know that this is a historical moment in the critical care group, because the very first PhD defense will occur today. So, and as I said, I highly congratulate both to the students and his supervisor for their brilliant job. And I am very pleased to hand over now the leadership and the mic to the chair of the PhD Defense Committee, Professor Andrea Fekete. Please start the PhD defense. Thank you very much for your attention.